Happy Tuesday, everyone. I hope that you are having an amazing start to your day. It's time to enjoy your morning tea with tea on this Talk Therapy Tuesday. I'm Tanya McLean-Nicholas, licensed marriage family therapist and owner of Renewed Hope Counseling. September is National Suicide Prevention and Awareness Month. And this month is dedicated to bringing education and awareness to the stigmas that are associated to mental illness, the signs and risks for suicide, and providing resources for those families who've been impacted by suicide. So keeping in line with this national movement, today I want to focus on suicide awareness and prevention in respects to our service members, veterans, and military families. So grab your tea or your coffee, whichever you prefer, and let's dig in. Suicide is a serious problem in the military community. Service members put their life on the line to protect our country. They leave behind their families and their loved ones to enter into what can be very stressful circumstances. From intense trainings to combat, being away from family and friends for prolonged periods of time, and other stressors that are related to transition away and even the transition of returning home. Many service members and veterans report feeling isolated as they adjust to the new demands of their job and just military life in general. There's increased anxiety as they prepare for deployments, or even the anticipation of readjustment to their families and the feeling that they do not belong once returning home from deployments. And not to mention trauma that occurs from combat, maybe loss of fellow service members, career setbacks, disciplinary actions, finances, or relationship issues. The list of stressors go on and are factors to mood and anxiety disorders, substance abuse, and even physical health problems for many service members and vets. When key protective factors are not in place or strong, this increases the risk for suicide. And some common warning signs that you may see could be feelings of hopelessness or express hopelessness or having no purpose. Maybe there's talk about self-harm or threatening to harm themselves, or feelings of just being trapped or experiencing unbearable pain. Talk about maybe being a burden to their family, maybe start giving away prized possessions, an agitation, or just behaving recklessly. Suicide prevention programs seek to reduce the risk for suicide and strengthen the individual through protective factors that protect them against thoughts or behaviors of suicide. So what are those protective factors? Well, continual mental and physical health care is essential. We have to focus on not just taking care of our physical body, what we put into it, sleep, exercise, but what also goes into our mind. We have to be comfortable getting the mental health services and support that we need. Ensuring that you're connected to supportive individuals, family, community, and social institutions are key. Coping and problem-solving skills are essential. Knowing how to manage emotions, knowing how to work through stressors and different problems in our life are very helpful as well. Having a plan or hopes or goals for the future are also helpful because it's forward thinking. It gives us something to look forward to. And having a strong cultural or faith belief that discourages against suicide as well supports our mental health and our spiritual health, giving us something to look to or hope for, bigger than ourselves. The completion of suicide is devastating on service members' families. They're left with feelings of guilt and shame because they question whether they could have prevented it, or just confusion because they may not have ever seen it coming. Knowing that suicide is a serious problem for service members and vets, it is imperative to be aware of the stressful circumstances that service members and veterans have to endure, to know the risk factors and warning signs, and to make sure that protective factors are in place that can lower the risk. There is hope and help available. If you or a loved one is at risk, please utilize the following resources. Veterans Crisis Line. They can lead you and give you the support and resources that you need. Get the help you need for healing, to stay healthy, and to stay hopeful. Well, I hope you enjoyed your tea with tea on this Talk Therapy Tuesday. I'm Tanya McLean Nicholas, and I hope you have a great day.